Hello, my name is Dr. Brian Hill. I'm a shoulder and elbow specialist with Palm Beach Orthopedic Institute. We see several patients each day with tennis elbow or lateral epicondylitis, and combined with our physical therapy team, we created this home exercise program to make it easier for you, the patient, to avoid injuries and keep being active. One of the first exercises I encourage patients to do is stretching. I like to do this with the arm extended and the elbow completely locked. Utilizing your other hand, you provide a force to your wrist and really feel the stretch of the common extensor tendons. I often encourage patients to do this first thing in the morning as we get stiff overnight, and then even at the stoplight or some other time during the day when they have the opportunity. Eccentric wrist flexion is essential. This is performed with a very small weight, typically 1 to 2 pounds, and helping your wrist come up and then slowly letting it down helps strengthen the wrist flexors. This is done about 15 times and completed 2 sets daily. Similarly, eccentric wrist extension is done with the forearm supported with a light weight. The wrist is supported coming to the top of the exercise and then slowly lowered. We often recommend to repeat this 15 times for a total of 2 sets. Elastic bands are extremely helpful for all exercises and can be found on online shopping sites such as Amazon. I like using these where you can attach them to a door and perform elastic band external rotation. This is performed 15 times for a total of 2 sets. We'll often tell patients to put a towel in their armpit to help with the movement. The exercise can then also be performed for internal rotation. And again, our excellent PA here, Eric, demonstrates the internal rotation portion of this exercise, repeating this 15 times for a total of 2 sets. Serratus roll slides are also important. Simply allowing your arms to slide up the wall and then bring them back down for a total of 15 times in 2 sets. And then we go back to the bands for horizontal abduction. This should not be too hard, and really focusing on keeping your palms up to abduct the shoulders. Again, this is repeated 15 times for a total of 2 sets. Lastly, we often recommend a transverse friction massage. This can be performed, again, with the arms supported and often supplemented with a topical anti-inflammatory cream. This is performed for 3 minutes, and typically we'll recommend to do this 2 times daily. Most of the times we recommend this to be done just before the patient falls asleep. Here's a PDF of the exercises. Feel free to reach out to us if you would like this sent to you. Thank you for following our program. If you continue to suffer from tennis elbow or other shoulder and elbow issues, feel free to give us a call or book an online appointment. Thank you very much.